heart of Indonesia, living in a dense jungle village, is a man who looks half man, half tree. 36-year-old Dede lives with a mystery disease that has encased his body with branch-like structures. His hands and feet span up to just under a meter, growing 5 centimeters a year. Now an American doctor is traveling to Indonesia in a desperate search for a diagnosis and even a cure.
This would be a jaw dropper for the dermatology community throughout the United States and really worldwide. This is a very unusual and impressive case.
As a single father to his 2 children, Dede struggles to provide for them.
Usaha saya ini saya nggak bisa apa-apa, nggak bisa ngasih apa.
His only income is to perform circus stunts with a bizarre collection of people. But with each new event, the mysterious disease worsens. Soon it will cover his whole body, risking his chance of death unless help can be found. The 36-year-old father of 2, Dede, is at work. He performs when he can in an Indonesian circus troupe, showing off his extreme skin condition to earn a living. We're in Indonesia to meet Dede and his family. Local journalist Kresna Astraatmaja has filmed the extraordinary footage of Dede at work. He's now helping us find Dede's home village.
Well, I heard that someone have a skin like a tree and hands and his feet is like a tree branch or roots. I believe this is real and we'll see when we get there.
It takes a whole day to travel from Jakarta south to Bandung, near Dede's village. But this is where the road ends. The rest of the journey will be done on boat and on foot. Dede's house is full of family and friends from the village. Eventually a shy figure emerges from the back of the hut.
Dede tinggal di sini udah lebih sering di sini ya.
With the disease spreading over Dede's body, it's becoming increasingly difficult to function. Dede has just got up for the day and shows us his morning routine. He needs his brother-in-law Imun to help him wash.
Namanya rumah ala kita. Iya nyari ya. Masuk mau tunggu sebentar. Masalah. Gunting coklat, gunting coklat. Hipus DP iya tuh tak ngomong itu murahnya tuh tak iya tuh. Ya kalau ada yang mau menyembuhkan, ya saya mau. Ada kalau ada takutnya saya takut penuh di muka ya.
Iman also helps Dede to dress. All his clothes are specially designed by a tailor to fit over his misshapen limbs.
Ada sleting sininya ada sleting, puter sini, sleting dimasukin gini.
Dede is now ready to explain his mystery condition and allow us to talk about his body.
Kenapa dia susah digerakin ya?
Yang kecil-kecil begini itu, yang gede terus tambah lagi.
Oh, itu terus tambah?
Iya.
So it's like roots that growing from the surface of the skin. Yeah, it's real. It's very real. It's not his finger, but the tip of the finger is like growing from the surface of the skin of the finger. Apa rasanya waktu diangkat gitu?
Rasanya ya berat ya.
Coba digerakin jarinya gitu. Apa rasanya?
Jarinya enggak.
Ya,
Cuman gini aja bisa gerakin.
it's about 5 millimeter each month. That's how fast it's growing.
Ya udah ada di sini sedikit ya. Kita akan 15 tahunan ya. Ya tadinya diambil ke diiris. Ya. Diiris enggak hilang. Yang muncul lagi tambah banyak.
Itu power pisan eta. Puncaknya.
He goes to visit his 2 children.
Ngaruh pola.
Yeah.
Unable to care for them, they live with relatives in the village.
Anak saya dua-duanya. Yang satu Itis namanya, yang satu Rentang. Itis sekarang umurnya 18 tahun, Rentang 16 tahun. Gak bisa membiayain anak.
Kasihan aja sama bapak.
Ya rasanya umur panjang ya. Pengen melihat dulu cucu. Ya kesana ya sedih ya. Anak-anak kayak ngurus ya. Jadi untuk urus ku abi. Ya abi dah ya. Dari penyakit dia dah tuh bisa membiayaan anak. Paling ku bibina diurus ya gitu. Guling kah? Ketawakan cai.
Dede used to work in construction and fishing, but by his 20s, he could no longer use his hands to grip.
Ya kabita ini mah, ngapain can bisa digawe deui.
He's desperate to understand his condition. News of his plight is spreading. Tomorrow, a world expert in dermatology will arrive from Maryland University to assess Dede. He hopes to diagnose Dede's disease and even find a cure.
We have to be careful with this patient. We act as if they have a very dangerous infection because actually until we know what they have, that's the God's honest truth. They could have something very contagious and very serious.
Afflicted for 20 years, Dede fears the truth. What if there is no hope? And what if it will also affect his children? In Indonesia, 36-year-old Dede lives with a disease that is encasing his body in tree-like roots. Most of the mystery growths are clustered around the limbs, but recently they've grown around his eyes, nose, and mouth.
Kepikiran saya ya karena pikiran yang penuh. Kalau penuh di muka ya nggak bisa melihat ya, nggak bisa makan.
An American world expert dermatologist, Dr. Kaspari from Maryland University, has traveled to Indonesia to try and discover the truth about the disease. He's on his way to Dede's village. He has some initial thoughts about what the condition could be.
I'm really interested in this case because it's so absolutely unusual. It looks like it's probably disseminated wart infection. The very severe growths that are on this patient's skin that are so disfiguring is just something that we don't encounter in clinical medicine.
He's sure it's a type of wart, small, rough cauliflower tumors caused by a virus infection. But if so, this is a wart infection like no other he's seen and needs proper investigation. In the village, Dede is having breakfast.
Bang mandi. Tarik.
He sits raised on a stool as his hands are too large to reach the bowl.
Ieu teh pamin teh nganggo sedotan mah, ieu teh susah ieu teh ngieuna teh ngaeutna teh gitu.
He's excited but nervous about meeting Dr. Kaspari.
Oh, kuduna ka Bapak itu tuh. Nah, nikmat, oh nikmat.
Dr. Gaspari travels with Dede's father and brother to the village.
Hello, I'm Dr. Gaspari.
He's already feeling the weight of responsibility. Single-handed, he's giving Dede's family hope.
I made it to the top of this muddy pathway without any major accidents. I'm really anxious to meet Dede. Hello, Dede. I'm Dr. Gaspari. I'm pleased to meet you. I've come from Baltimore, Maryland. I'm here to help you find a way to help you get better. It's impossible to tell whether you're seeing the palm side of the hand or the top of his hand. I'm absolutely stunned. It's florid. I've never seen anything like this before. The impact of the condition on this young man's mental state is readily apparent. He's sad, he's depressed, and this really has him down.
Dr. Gaspari confirms that it's warts, but establishing which wart virus strain is going to require medical research. Warts are a tumor caused by a virus that lies dormant in the body. Usually, warts will appear from months to a few years, but in Dede's case, the warts have appeared to grow and spread, producing cutaneous horns on Dede's limbs, a waste product of the wart. For a full diagnosis and possible treatment for Dede, Dr. Gaspari starts with a full-body examination.
I'm going to pull your eyelid down, okay? Just look up there. I'm not wearing gloves. In terms of me acquiring a wart from touching it, that's not going to happen. I'm looking for a certain kind of morphology, a flat red scaly lesion, which is what I'm not seeing. I'm seeing some things that I wouldn't expect to be present.
Dr. Gaspari does not recognize the size and shape of the warts on Dede's body. It's a unique, unstoppable infection. Local doctors attempted to remove some of the warts 10 years ago.
Udah dioperasi, cuman ada 3 minggu. Perkiraan langsung 3 minggu langsung muncul.
It is life-threatening for this patient. This is absolutely real, and it requires attention.
Mau diobatin. Saya mau diobatin, minta diobatin.
What we're doing right now is we're trying to find out about the disease by taking this history and then again taking some of these samples and studying the samples. That will be the first step toward making the diagnosis.
The doctor is worried by the large amount of warts and tree-like branches on his body. They could turn cancerous in just a few years' time.
The longer the disease exists, virtually all of those patients develop skin cancer. So early detection is important so the skin cancers can be treated readily when they're small.
To identify malignancies, Dr. Gaspari will need to surgically remove wart samples from Dede's body. The biopsies will also be used for testing to diagnose the disease back in the USA.
We're going to take 4 samples. We're going to inject some numbing medicine under his skin. Then we'll take the sample. The head right there.
Due to the cramped conditions, Dede lies in the middle of the room. Village well-wishers gather round.
You going to feel a little pinch? Ask him what is this sharp or dull?
Feel a little bit sharp.
A little sharp?
Yeah.
You still feel it? Sharp? Okay.
Dr. Gaspari is freezing the skin around a large wart. It has to be big enough to supply information for extensive testing in America.
Keep that in there.
Removal of the wart is a tricky procedure.
Put a little bit more.
Each wart has its own blood supply, and bleeding can be difficult to control.
This is bleeding more than I would expect. It's taking a little bit longer to stop bleeding.
The bleeding is a setback. With the nearest hospital 4 hours away, Dr. Gaspari has to stem the flow of blood with only a basic medical kit.
This is a big one on the stalk, and that's probably why it's taking a little bit longer than...
Dede's son, Entis, looks worried for his father.
Okay. All right.
Eventually, after 30 minutes, the wound left by the removed wart stops bleeding. It's getting dark. Dr. Gaspari must work quickly, choosing smaller samples which won't bleed as much.
Right in the anterior chest. Stop. You feel that? A little bit? Right. The last one, and we're done for tonight. So, mission accomplished. We have 4 biopsies for permanent sections. Goodbye, Dede. Good night. And I'll see you tomorrow for a follow-up evaluation here. Ooh, look at all the little frogs. I can't see. I don't know which way to go. Oh, thank you. The one thing that's missing from the jungle feel are the insect bites. It's been a great day. Met the patient, got my samples. Now I'm going to go to get away from these bugs.
It's morning, and Dr. Gaspari has returned for a second day of medical tests on Dede. He's beginning to piece together his initial findings.
Yeah, the challenge yesterday was working under the cramped conditions. There was definitely a malodor associated with the exuberant growth that he had in his hands, and that probably indicates there's bacterial colonization of that. The only thing that could have gone wrong is he could have had more bleeding from that first biopsy site, but other than that, not much could have gone wrong.
Semalam nggak kerasa apa-apa gitu.
Tidur nyaman.
Tidurnya nyaman ya.
Seperti kagak
diambil ini karang saya.
The doctor starts by injecting yeast for an immunity test. This might provide answers as to why the condition is so extreme. If Dede's immune system is weak, he can't fight off infection.
If the test is positive, if the immune system is working correctly, it'll be a little bit red and swollen there.
The results will be ready at the end of the day. One of the warts yesterday, when removed, bled excessively. The doctor is worried it could be a source of infection if it hasn't healed.
Oh, looks good. It's healing very well. The biopsy site is good.
Dr. Gaspari is relieved that Dede has remained healthy throughout testing. Now he'll take blood samples from Dede and his entire family to try and shed light on the genetic history of the disease.
I just had to maneuver between a couple warts that were in the area, but he has a nice plump vein there, and it's working out. The family really feels helpless. They're sad about their son's condition. They don't know what to do.
Herannya ya dia punya penyakit kayak begini, penyakit apa, nah itu mungkin dia pikiran dia itu bisa anaknya Dede.
The blood results will reveal that either the mother or father is asymptomatic, a hidden carrier passing the virus to Dede.
Khawatir punya penyakit begini, khawatir ke anak saya.
The genetic test results will be ready in 2 months' time. The results of the earlier immunity test are ready.
The skin test one.
They should give some clue as to why the virus is so virulent.
Left arm over here, yep. It looks like it's slightly pink, a very weak reaction so far. It means that the widespread wart infection is something that his immune system couldn't handle.
At last, Dr. Gaspari has an initial breakthrough. It seems Dede is unable to fight the virus, as his immunity is virtually non-existent. It has manifested into a wart virus infection.
And you just lay there for a couple minutes and then you could get up. So we're all finished and you did great. You did wonderful.
There's no treatment Dr. Gaspari can offer Dede until he's conducted further tests back in America. He can only suggest making life easier by trimming the branches on Dede's limbs.
He'll probably need to saw through them using a hacksaw. Dede, it won't hurt you. It won't accelerate the growth of the warts.
Siap gitu.
Mana gitu, air dikurang.
Dikurang. Baik gitu mah. yang biasalah Pak dia kurangin.
This is so extreme. This is not described in any dermatology textbooks. Surgery treatment is not the way to go to treat these warts. It's already been used and it's failed. The most effective treatment is going to be a medical treatment, inside-out kind of treatment.
Senang.
Dr. Gaspari feels confident he can design a treatment that will allow most of the warts to disappear. Just as Dr. Gaspari prepares to end the consultation, the village has some unexpected guests. Dede's circus companions have come to visit.
I believe the clan is arriving. The clan is a group of cohorts that are also afflicted with various conditions that Dede associates with.
He seizes the opportunity to diagnose each of the clan as they arrive.
Hello, I'm Dr. Gaspari. Von Ricklingshausen's neurofibromatosis. Hello, I'm Dr. Gaspari. I'm Dr. Gaspari.
Oke, apa kabar,
Pleased to
Dek?
meet you.
Sekarang mau ketemu sama Dede.
Masa Sunda kita nanaon lah.
Halo, baru ketemu
The clan is a group of people with rare medical conditions. Dede performs with them in a city circus to try to earn a living.
Iya, bercanda terus main ngobrol-ngobrol kayak istilahnya biasa aja sama teman-teman yang lain. Nggak istilahnya nggak dibeda-bedain dah.
The bubble man and the associate have neurofibromatosis. Each of the bubbles under the skin has a benign nerve growth that is causing the bubble to form.
The clan has without notice come to the village to take Dede to perform in the next show.
Collectively, I have not seen such an unusual gathering of patients with very rare diseases. There's absolutely shared pain among these individuals because of their chronic skin conditions. No doubt about it. Some of the cases they're treatable, yes, but not all of them.
Dede invites his friend Trebulum, known as Bubble Man, into his home as he packs.
Rumah saya di sini, Kampung Cipete, Desa Saguring. Terima kasih menjenguk saya ke sini dan semuanya.
Now the clan must travel to the city for a show. Dede is told he has no choice but to come too, if he wants to retain chances of future work. Jeeps are waiting at the nearest road. Dede is unable to walk on the rough road surface. Imun, his brother-in-law, gives him a piggyback.
We'll work on the samples that we've taken and we'll give you some good news. That's what we hope. Okay, very good.
He must say goodbye to Dr. Gaspari. Dede has no choice but to perform in the clan, if he wants to provide for his family. Across the world in Romania, astonishingly, a second case of this extraordinary condition of warts has come to light. 38-year-old Ion Tauder is a farmer who suffered from the disease since he was a teenager. Living with his mother, who cares for him, he's found it increasingly difficult to earn a living. After years of trying to find help, news of his condition has spread. Today he's been admitted into the Floriasca Emergency Clinic Hospital in Bucharest to have an operation in a few hours' time to remove the warts on one of his hands. Dr. Laska, the chief of plastic surgery and reconstructive microsurgery, will carry out the experimental operation. Ion can no longer move his fingers and toes, as he has a thick layer of warts covering his hands and feet.
This is the worst case I ever see.
Where Dr. Gaspari with Dede favors non-invasive treatment using drugs, instead in Romania, a team of 12 will try to help Ion with surgery. It's time for the operation. Ion is laid on the operating table, and his hand is cleaned and prepared for surgery.
This surgical procedure will be between 4 and 5 hours.
After the anesthetic is administered, Dr. Laska begins the intricate process of cutting the skin off the hand.
I start to remove the tumors, and step by step, millimeters after millimeters, and finger after finger, the tumor is removed.
It's one of the most difficult parts of the operation, as the team needs to preserve as many muscle and nerve endings as possible.
And after this surgical part, will be necessary to stop the bleeding.
One wrong move could also mean huge blood loss, as they could cut the connective blood vessels feeding the warts.
50% of the surgery is the job to stop the bleeding.
The skin is slowly teased away from the muscle, closing each blood vessel opening as they go.
This was the risk part of the surgery, the bleeding.
With the skin tissue removed from the fingers, one last pull is needed to break it from the rest of the hand. Eventually, the whole sheet of skin off the hand is removed in one piece. It's the second stage of the operation. The decision is made to graft skin from Ion's thigh, one of the softest parts of his body. The slicing of the top layer takes a few minutes. Although crude, it's a delicate procedure, as Dr. Laska has to avoid breaking the healthy skin. The team must stitch the skin carefully around each digit. All the remaining graft has been used. It's up to the doctors to give Ion the best possible chance by spending the next hour bandaging.
The second surgical step is finished.
Now Ion must recover in hospital for 2 weeks before it's established if the grafts have taken.
We will have no problems with the evolution. Okay.
It's the day of discharge, and Ion is recovering well. Dr. Laska needs to examine his hand and assess his recovery.
Ce faci? Fratele lui Ion? Semănați. Și ăsta de asta de ce lui Ismail? Hai, toate, strânge-le foarte bine. Încearcă să apropie să vezi. Acum și că, ia uite că am făcut progrese serioase față de bravo. Nu știu. Dar să-mi zic, dacă l-am folosit acolo, și cum să încep cu... 20 years ago was the last time when she can shake the hand.
Ion writes his signature for the first time in 14 years. His brother Vasily will now take him home. He has lost many of the nerve endings in his hand, so he'll have to be careful what he touches.
Să mă trăiesc mai mult să nu ating ceva care să mă prigă. Distanța de la cer la pământul ăla, ce e aici și din coace, cum a fost și cu Nesie, la distanța de la cer la pământ.
It takes almost a day to travel to Ion's village. Family and friends have gathered outside Ion's house to celebrate his arrival. Ignored and isolated before, now Ion is the toast of the village.
Ce-ți fac?
Cum este el? Uite, a făcut treabă bună. Poate-ți rău, dar mai... A fost nasole? Ele care ne projerează sare, cum e ăla care crede sub. Să o aruncă mare.
Many can't believe how effective the surgery seems to be, and demand evidence of where the new skin on his hand was taken from. Tomorrow, Ion hopes to start work once again as a tractor driver, but he's anxious. Will he be able to grasp the wheel and drive, providing money for himself and his mother?
Și dacă vine totul pe aici, de acolo le încoace mult, că poate trece mai merg cu tractorul pe drum, la arat, la discuie, la sămânat, fac lucruri de astea.
Dede has arrived in Bandung City, Indonesia, along with the rest of the members of the Sadaluk clan. His fellow performers who, like him, are physically scarred from rare medical conditions. They'll perform their next circus show tomorrow. Dede is waiting for the results of the wart biopsies from America, which will begin to shed light on his mystery condition.
I've met the patient, we've taken some diagnostic samples. Now the next step is to analyze those samples and to come up with some answers. We really need to free him from the confines of these thick shell of armor that's encased his body.
It's the day of the show, and Dede and the other clan members have just woken up. They're living at the show venue, a shopping centre.
This is where all the men on the side are sleeping.
A man called Boy runs the clan day to day.
They share the room except for Dede. He has his own room. Because of his smell, some of the clan need to be separated.
Clan members Trembolum and Imat are getting ready for the day. They've been given the names Bubble Man and Nose Man.
Acara, kudu siap-siap dulu. Ya mani dulu, nyikat gigi dulu ini, ayo siap.
The clan was created by entrepreneur Hani Suwento.
Hanya setelah saya ambil, mereka orang yang ini apa artinya yang tadinya nggak dikenal orang sama sekali. Mereka populer karena saya populerkan.
One of his biggest dream was 100 super extraordinary people in one place and put them just like when in your country a museum like Madame Tussauds. All these strange people make some kind of attraction like Disneyland. People are willing to pay to see all those people in one place.
Hani and his associate Boy believe that what they're doing is right. They're giving the clan hope, some money from the performances, and a purpose in life.
We are so proud to help them to make their lives even better, to make them earn some money. Nobody wants to employ them. Nobody wants them to work for them. Just helping them as much as we can.
Ya ini. Apa ini? Apa ini? Ayo. Pak. Dulu dah iya itu sama itu. Berapa?
Dede and the clan gather their strength with a meal. They've become friends through adversity.
Dek, kalau makan susah nggak, Dek? Kalau susah kan dibantuin. Agak susah, Dek. Susah. Ayo, Dek, bisa nggak, Dek? Makan, Dek. Matang itu bisa nggak, Dek? Kalau disuapin ya nggak mau. Disuapin? Nggak mau. Disuapin nggak mau? Dek, sifatnya masih bukan pendiam. Ya senang humor sih. Ini siapa? Si emak. Pemalu orangnya. Si bapak. Emosinya gede. Pak Dewala orangnya sabar. Kalau marah-marahan nggak ada. Istilahnya di sini ya pikiran lah, nggak ada marah-marahan. Kalau bercanda sering, fisik enggak.
The audience has already started to gather. Boy has gathered the clan early to talk through the performance.
Ini ya ada sedikit perubahan. Hari ini tetap ada pertunjukan. Yang bikin itu kait itunya, Mbak, bajunya. Ya.
Dede and his friends are putting on brave fronts. Soon they'll have to face audience reactions to their appearances, and it never gets any easier.
Di sana lamun aya isina aki-aki tidak hidungnya panjang ini. Nah, tuh bapak dikemarin atau pada cicing wae. Gede bis pas saya gitu, mentak orang mah ngelehan wae gitu. Ada sih yang ngata-ngatain begitu. Ya amat ngomong sama Dede, biarin aja yang ledek, nggak jadi masalah. Yang penting yang diledek bukan Dede, yang di atas yang ledek. Bukan istilahnya penyakit Dede bukan kemauan Dede kan, nah, gitu.
With an hour to go, the clan change into outfits that emphasize their physical deformities.
Nah, saya ceritanya bapak manajer ini katanya kalau mau dipotong-potong ini supaya katanya kelihatan.
They'll be performing with children who they've never met before. One of Boy's ideas.
It's spontaneous. It just came up last night.
Model kayak gitu. Nggak boleh. Itu kalau tidak makan sayur satu. Hah? Saya nggak gigit loh. Kamu sama saya juga.
Mukanya tetap ngeliatin ke depan, senyum. Ada yang takut-takut, Tante Ani tarik nanti. Liatin aja. Sebelumnya lo ini loh. Mukanya jangan, nanti pose jangan gitu. Senyum aja biasa, ya.
Be nice to have the clan performing in front of the children, showing that the children are not afraid of them.
Senyum, semuanya senyum, nggak ada yang cemberut.
Ada ya, bagus.
Bagus, anggap aja nggak ada.
Ya, lebih bagus.
Manusia,
Karena apa? Mereka juga sahabat, ya.
Ini pasti dipilih manusia. Apa baik?
Dede and the clan discover that the children are models who've been practicing a routine for weeks.
Masuk.
Jauh, jangan deketan.
Enggak malu saya, ada banyak teman di sini, ada yang bantu.
Some people say that we are taking advantage of them. Those people who keep saying that, what do they do to help these unfortunate people? They do nothing. This is our way to help these unfortunate people.
The show is over, and the clan seems pleased with their contribution. But Dede can only think of his own children back at home.
Bu, hari ya, Dede di itu, Bu. Oh, di itu. Iya. Roti nu tadi dimakan heula kayak ieu.
Dede must continue to perform with the clan in further shows to provide for his family. His only hope of another life is for Dr. Gaspari to find a treatment for him soon. In America, Dr. Gaspari has been testing Dede's extraordinary strain of warts for 2 months. He now has the final diagnosis and is startled by the results.
This extreme case of warts I've been seeing my entire career. He's got some kind of severe immunodeficiency, and I think that's really going to underlie all of this in immunodeficiency. That's what we need to work. And I think that's going to be the key to treatment.
The results prove conclusively that Dede has an unusual immunity defect due to a low white blood cell count. His extreme condition is probably one of a kind.
What's unique about Dede is the extent and the severity of his infection, not necessarily the infection itself.
Dr. Gaspari will present his findings to an influential board of doctors, hoping to obtain funding for treatment.
This gets at what do we do for our Indonesian patient. We have planned to obtain a retinoid compassionately from a pharmaceutical company and to give him oral therapy.
I don't know, it's a suggestion in sense, but I've seen retinoids work, and I think it's a good start and a good first.
Then I probably would add an antimetabolite, which can result in dramatic regression of the warts. I didn't see any evidence of skin cancer in this patient.
The series of drugs Dr. Gaspari is describing should mean that most of the warts will miraculously disappear. Dede is not suffering from skin cancer, and his children will probably not show symptoms of the disease.
Phase 3.
It seems he has a real opportunity of a better life. Back in Indonesia, Dede wants to get home to see if there's news waiting for him from Dr. Gaspari. Before he can return, he has to take part in a magic show.
Senang. Kedua, jalan di atas bara. Tiga, mandi api. You don't have to worry. It may look dangerous, but it's not. They've been doing this for quite some time.
Nanti akan melihat penampilan agak susah untuk demonstrasi. Jadi ini satu kesempatan. Ini manusia laga yang akan mendemonstrasikan.
We are concerned by what we are filming.
Don't worry. It's not dangerous to them. You can see their faces.
The clan looks terrified. For the final act, Dede is asked to pull a 2-ton truck up a hill by his hair.
Dede kenapa-napa di atraksi ini?
Wah, saya udah percaya sama itunya ya, sama yang ngaturnya itu ya. Nggak bakalan apa-apa gitu ya.
The show is over, and Dede tells us he's not hurt. We were distressed by what we'd witnessed. With some money to provide for his family for the coming months, Dede can return home. With a real possibility of treatment, there's hope that Dede's life in the circus could be over. In Romania, Ion Toder has finally reached the day he's been waiting for 18 years. He's back at work, driving a tractor. Nearly all the movement has returned to Ion's hand.
Da, să mă fac bine și...
Da, dacă le-ai amândouă mai gândite.
Dacă o să mă fac bine, să fie viața mea așa, o să mă primează ca pot să vă spun. Aici nu înseamnă cele nu spune, dar dacă mă fac mai bine, pot să mai bine, că trebuie să mă plec mai mult, așa și Constantin de Sat o să mai fie mai altfel.
With regular medical checkups, he might have a real chance of providing for himself and his family. Happy to look to the future. In America, Dr. Gaspari has finalized details for free treatment under local medical supervision for Dede. He's explaining how he can be helped. In Indonesia, journalist Kresna Astra-Atmaja goes to Dede's family home to deliver the letter. Dede is away, so Kresna explains the diagnosis and treatment to the family.
Ayo di mana Dedenya Aida?
Di mana ya pindah ada?
Hari disumbangkan di naon? Saya diminta untuk ngasih ini surat ini surat dari dokter. Ada harapan untuk pengobatan. Karena jika diizinkan oleh Dede dan oleh keluarga, pengobatan jangka panjang dengan obat yang namanya asetretin. Paling nggak bisa megang, tujuan utamanya yang di tangan itu dikecilin, dikurangin, dan yang di muka itu di...
Hari ditaruh mah ternyata dengan mengawai tanpa ada diobatan mah hoyong.
With Dr. Gaspari's treatment, most of Dede's warts will disappear. He would then be able to return to fishing and look after his children once again. But at the moment, Dede has not taken up the offer. There are rumors he continues to work with the clan.